Hey, what's up, Sugar Bushes? I'm here with my doctor, Dr. Livingston at Restorative Wellness Center. And I know a bunch of you have been asking me, like I told you on TikTok and stuff like that in my lives, that I've been doing ketamine treatments, so I don't want to unalive myself all the time. And I know you've been asking me about it, and I've tried to explain it to you, but I don't know the big cool guy words for all the things that happen. So I asked my doctor, who's a great friend of mine, super good guy, if he would take the time out of his precious day to sit down and explain to you what it does, how it's a different form of treatment for depression amongst other things that you got going on in your life. Because I'm the kind of person that doesn't want to do like a medication song and dance. That scares the shit out of me. Right. So when you explained this to me, I was like, I might as well, you know, why not?
Give it a whirl, right?
Yeah, absolutely. But yeah, so what exactly, how does ketamine treatments affect the brain when it comes to, you know, being fucking sad all the time?
Right, of course. And if we knew the exact mechanism, that'd be great.
Yeah.
We really don't know exactly what it does. We know that it's effective.
Yeah.
It activates several areas of the brain that are kind of unique. It also activates GABA, the neurotransmitter, which is an inhibitory neurotransmitter. So it sort of slows down some of those negative thoughts.
Okay.
It also activates areas in the brain where other hallucinogens might, something called synesthesias, so you can get new areas of the brain connecting, which don't do otherwise. When we're in control, we can kind of, well, guide the brain a bit, but with ketamine, that doesn't happen. You get out of your own way. Things sort of start happening.
Okay.
New connections are made in the brain. It's really unique and effective and rapid is what's really cool about it.
Yeah, it's extremely rapid. It was like, because you told me, you were like, oh, you know, after you do it, you're going to feel better. And
Right.
I was like, you're full of shit.
Yeah.
Because I do trust you in your medical expertise because you've been doing this a long time. But I'm also pretty wary of any snake oil salesman that says this is going to make you feel the best in the world.
I never said that.
Yeah, I know. But that's what my brain interpreted it as. And you're like, you're going to feel better. And I was like, well, I feel like shit all the time. So I don't know how that's possible.
For sure. Yeah.
I've tried everything. And like I said, I got the money to go and fill medications all day.
Right.
Speaking of that, how much does a ketamine treatment usually cost?
It depends on where you go.
Yeah.
You know, here, I just charge $200 a treatment. I have
$200.
no one sign up for any set number of treatments, so it's just as you need them.
Okay, no way. That's
a lot
insane.
of places much higher than that, but we want to make it affordable and accessible.
Yeah.
Because it does save lives. It makes the difference. Depression scores, and I told you that, you know, and you'd feel better. And you did.
Yeah, I did. I feel way better. And like I told you guys, it's not like an instant, everything's okay and I'm going to be all right. But the sense of impending doom and being sad all the time, it's still there, but it's not taking an overwhelming portion of my brain to where I can actually function. It's been really hard for me to put out content because of that. So like making my true crime videos, because that's 2 hours of filming, about 4 or 5 hours of editing. And just thinking about that, I'm like, I don't want to do that. But
Right.
I want to get content out to you guys, so this has definitely helped me be more motivated and wanting to actually do the things that I love and not losing interest in things like that.
One of the neat things, a study recently kind of looked at what happens to patients who have the treatments. And one of the things they found is it reduces the negative predictive value of people who are depressed. What that means is typically depressed patients see the world as negative. Every experience tends to have a negative slant or tilt to it. And what it does is it reduces that. So you have something that could be a positive experience and you go, well, that sucked. You feel like, hey, that was okay.
Yeah.
You start to feel less like Eeyore and more like poo, perhaps, or something. You know?
That's a good analogy. I like it.
Strange, but you know, kind of fits.
Yeah, it works. It
kind
works.
of fits. You know, people might get that.
Yeah, absolutely. So would it definitely be? I guess you can't really compare apples to oranges, such as medication versus ketamine treatments. But would it be something you would recommend over doing the medication song and dance? I know that's probably like, again, comparing
No, it's not.
two different things.
It's really not that different. We know, at least percentage-wise, the number of people who get better on antidepressants, 40% on average.
No shit.
Sadly, in those same studies, 30% of those patients will get better on placebo.
Oh, okay.
So the only difference is about a 10% difference coming with significant side effects of antidepressants.
Okay.
I'm not against antidepressants, other than we use them like multivitamins at this point.
Yeah.
Start somebody on it, the doctor says, well, how you feeling? You feeling good? 6 months from now, come back.
Yeah.
What the hell?
Yeah.
Good. 6 months from now, maybe you'll be alive or dead. Who knows?
Yeah.
But you're still on the medicine, right? Sexual side effects, weight gain, GI upset, all the things that come along with antidepressants because of serotonin elevation just aren't present with ketamine. It can be used in conjunction or in place of medication. I have patients both that are on medicine and patients that aren't. Most of the patients we see have already given up medication. They've tried 5, 6, 7, 8, 10, and they go, fuck it, this ain't working for me, I don't want it anymore.
Medication scares the shit out of me, because I've talked to people and they're like, yeah, you know, you may get put on medication that's doesn't work, or it makes things worse, and I'm like, I'm not going to play Russian roulette, and I don't have there's nothing against people who are. People find medication, sometimes it works right off the rip for them, and that's great, but that's just not something I wanted to test, because my emotional and mental stability is already not great, so I don't think it could take another hit like that.
Right. And the sad thing with antidepressants, even ones that are effective, are still going to take anywhere between 4 and 8 weeks before they have a positive effect.
No shit.
You can start with side effects initially. You can have GI upset, you can be sedated, you can decrease libido or erectile dysfunction or any of the other problems. Those will start quick, but the antidepressant effects take time. Has to build up in the system. This, unique in the sense as you've experienced.
That's insane. I didn't know that it took medication that long to actually take effect in not making you depressed anymore, anxious, whatever.
Right.
When, like I said, I had my first ketamine treatment a couple weeks ago, maybe a month now. And it was, it wasn't like I was instantly better, it fixed all my problems, because, there's not really anything that's going to do that for you. But it was definitely, less a sense of impending doom, more motivation to actually do the things that I like. I didn't wake up all the time and just not look forward to anything. I actually wanted to do shit. I actually wanted to be social too, which is a problem I have, especially with quarantine coming and stuff like that, or being around and not wanting to be around people and things of that nature. Can you explain what the process is like when you get treatment? I know you can't, it's an individual experience you got to do, but kind of
So what we do here is just an intramuscular injection. A lot of places will do IV treatments, and that's fine. They're both semi-equivalent. I prefer the intramuscular injection. It's just easy. Get the shot, lay down, go about your, basically a mild trip. You have a mild experience. Dissociation is what we call it. And what that means is essentially you're out of your own way. And that's the big thing. The degree of dissociation, or how sort of trippy, I suppose, it is, often equates to how effective it is as well.
Okay.
So if you just lay there and you're just kind of relaxed, probably not going to get a great result. Ketamine's an old surgical anesthetic, guys. If you are wondering, it is Special K. That is the street drug.
Yeah, I know. When I first came in here, you were telling me what to expect, and you were like, it's not like, because I had never done ketamine before, but you were like, it's not like, you see people at parties doing ketamine and having a good time. You were like, I'm going to put you in a K-hole. And I was like, oh.
Yes, sir.
I'm very nervous now.
Well, and we walked through that. And it was okay. But the higher doses can be used in surgery and in veterinary medicine. A lot of people ask that. Isn't that a horse tranquilizer?
Yeah.
It sure is, but it's a human tranquilizer too. Again, dose dependent, right? So surgical doses are anywhere between 12 and 15 times the dose that we're using here.
Oh, okay.
So much, much higher dosing. And the dosing for addiction versus depression and PTSD are also different. The addiction dose to reduce cravings for all drugs is quite a bit higher. That's more hallucinatory. Used pretty rarely because of the effects. It's pretty intense. Would not start there in most patients unless they came in saying, man, I'm good with doing drugs. Because it is an intense experience.
It is,
The dissociative experience is almost pleasurable for most. It can be a little frightening in the beginning when you sort of start to melt or become part of the couch.
Usually when the word dissociative is said, it has a negative, it puts a negative taste in your mouth, because that's what people usually use to describe, their depression or their anxiety. It's that they become disassociative and they can't do anything, or they can't motivate themselves and they don't feel real, maybe. But in this sense, it's not. It's, as someone who's tried it, it's a humbling experience, and like you said, you get out of your own way. You're just not thinking the thoughts that you usually think, and you kind of figure stuff out about yourself. Like I was in the back room having a treatment, and I was looking at the light show you had on the ceiling, and I saw one of the green lights that was on the wall. It looked like a guy doing push-ups, and I was like, I hated the Army. Why did I join the Army? Why did I want to prove myself to my stepdad? Why did I do that to myself? And I was like, fuck.
So those epiphanies, those rationalizations or understandings do come at some point. And everybody's experience is different, even from one treatment to the next. You don't know what to expect going in, and you just let it happen. The more control that people try to have, the probably less pleasurable, the less effective the treatment is.
Okay.
And so coming in with the idea that you're going back to have a positive experience is the way to come in. The mindset, people will ask, what do I think of? Try.
Yeah.
I don't know. Good luck. Because you're not really in control of what's going to happen at that point. And for some, again, that's why I start at the lowest recommended dose, so it's not too intense in the beginning.
Yeah, I was very nervous, very, very nervous my first treatment, but you were very good at being like, it's going to be okay, I'm going to take care of you, it's going to be all right, and it was a very, very pleasant experience. And like I said, there are negative side effects to everything. Can you explain some of the negative side effects someone may encounter when using ketamine for treatment? Right.
So actually, other than the true dissociative experience being perhaps anxiety-inducing or uncomfortable due to the loss of control, there are very, very few side effects because of the fact it's in and out of the system so quickly. Right. The main side effect, if you will, is need to pee.
Yeah, that's really very true. About it. That's very, very true.
Some people, especially at higher doses, can have nausea. Occasionally, that's our wreck, sorry. Occasionally headaches during or after the treatment. Nausea is a possibility. And then some people will basically get pretty tired after. So they'll have their 40-minute hour experience and then we let them nap.
Be exhausted, yeah. Oh yeah, it's definitely...
It's a pretty intense experience.
You're laying there, but I don't even know how to describe it. It's because you're literally just laying there, but it's also like, you're putting in a lot of energy to this, and it's
mental gymnastics for sure. I mean, there's a lot going on.
Oh yeah, I was talking to my therapist about doing ketamine treatments for my first treatment, and she was talking about how she prescribed it to one of her patients, and it caused him to have a schizophrenic episode. But I would imagine for that to happen, you would have to already have some kind of that would already be in your genes.
So that would be a unique outcome. What I have seen is repeated treatments in a short period of time, and often this is someone who is, abusing it on their own.
Okay.
Mania or hypomania is a possibility. Now, a schizophrenic episode in a non-schizophrenic patient makes zero sense.
Yeah.
It doesn't make any sense. And mania or even hypomania in a bipolar patient is pretty rare.
Okay.
Because of the fact it's in and out of the system so quickly.
Yeah.
When you see a case study of one, it's hard to put much stock in that.
Yeah,
what happened to that one patient?
Anomaly, basically.
Right. Yeah. So what is that experience? Very, very rare to have any ongoing negative effects because it is in and out of the system really rapidly.
Okay. Yeah. So I figured as much, but like I said, I don't want to sit here and preach that this is a cure-all, be-all, take this and you'll feel okay. There are negative side effects to everything. Same thing with medications. There's going to be negative side effects to ketamine treatments, even though they are, like Dr. Livingston said, they're rare, but they can happen. Yeah, but it's possible.
So most studies will show that effectiveness, meaning depression reduced by at least 30% or more, is between 75 and 90% of patients. It is not 100% effective, as is no treatment.
Yeah.
And typically the recommendation is if you've not seen significant improvement after the third treatment, it's probably not going to work.
Okay.
But at that point, you tried, and often again 90%. So you're more 1 in 10 is not going to have a positive effect versus your 6 in 10 that are not going to have a positive effect from your antidepressants.
And you said what percentage of people have a positive effect from it?
75 to 90, depending on studies.
Compared to the 40. Medication, 40%. That's an insane number.
Yeah.
Doesn't seem like a lot, but when you're talking about people's lives, it's...
Well, it is an astronomical difference if they're going to approve a medication that comes with multiple side effects, and it's only a 10% difference from them taking nothing.
Mm-hmm.
We're talking about doubling the success rate in a treatment that's effective almost immediately versus take this pill for the next 4 weeks, come back and see me, and if you're not throwing up and shitting on yourself, we'll increase your dose and make you feel better.
Jesus Christ. Yeah,
well, the side effects of antidepressants are significant. And the most common is GI upset. And that can be everything from diarrhea, nausea, vomiting, or just, GERD, reflux, all sorts of problems, because the GI tract has such a high amount of serotonin receptors in it.
That's terrifying.
And that's why that is the #1 side effect.
Yeah, that's another reason I just didn't want to do the whole medication thing. And like I said, if that works for you, hell yeah, stick with it. All for it. We'll support you here. In this community, we don't fucking judge you. We will always support you no matter what. But that's just not something I wanted to go through, so this was the next best thing, and Dr. Livingston talked me into it, even though I was super nervous about it. But it was a great experience for me personally. Your experience is going to be very different because it really is, something very, very personal. but I do recommend it.
For sure.
I'm sure he recommends it, and he's a doctor. I didn't even go to college. So, but if you guys have any more questions, leave them down in the comments, and next time I'm here, we can do another one, because we just shot this from the hip like I do all the stuff I make. So if you do have any questions, leave them down in the comments, and they also do live streams on their Facebook. They also have a YouTube channel, which I have a link in the description of this video. Give them a sub, check out their videos. You can learn a lot. Very, very intelligent person, so I highly recommend checking out their content. But if you have any questions, let us know, and I will, once I come back, we'll shoot another video and answer whatever questions you have. Thank you for doing this. I appreciate it.
All right.
What's up, Sugar Bush? So let's talk about the experience I had after that interview. So we go into the back room. Dr. Livingston ups my dosage by a very minuscule amount. It's maybe 25%. I think that's what he said, but it's not anything like super mega, not even a gram, you know, just a couple milliliters. And I about damn near had a religious experience. So usually, like my last time, I've only done it, that would be my third time. So the first time he dosed me up, I never touched ketamine or anything like that, and you know, I was a little scared, but I trust him. You know, he'll take care of me. I sit there in the back room, and it starts to hit, and I'm like, okay, you know, I can understand why he said make sure you use the bathroom because it stimulates your bladder, as well as, you know, it's going to be hard to move. It's not so much as you can't move; it's just your body feels like it's moving through molasses. But that entire trip, the first time, I enjoyed having my eyes open and looking. What? Do you want treats? Okay, hold on. I gotta get the cat treats. Hold on. Come on. Come on. So I kept my eyes open because he has these really pretty, like, light shows playing. I keep my eyes open and I'm looking at this and it's really cool, and I have some really cool realizations. Like, I hated the army. I saw a little green guy doing push-ups, like I said before, and I was like, man, I really only did that to prove myself to my stepdad, you know, and make him like me. But anyways, but it was cool. Like, my eyes were open, I was chilling, I was vibing, I was super zooted, but I was, you know, I was conscious, coherent, good to go. The second treatment I had was not like that. It was very much more chill. I guess my body adjusted to the first dosage. It was very short, but it was still intense, and it was a good experience. It was definitely needed, but it wasn't like the first one. The second experience, or the third experience I had, which is the one that I had right after we got done filming that little interview, was damn near religious. So he shoots me with the ketamine, jabs me in the arm with it. I set up the camera to record me laying there, but it's so dark you can't really see anything, so there's really no point in putting that footage in. But I was sitting there, and I set the camera up, and I was like, I got the shot, I put my shirt, like, back on. I got in front of the camera, I was like, all right, you know, I'm going to set the camera up just to make sure, so you guys can kind of see what the experience is like. And as I'm talking, I can feel the feeling wash over me, and I'm like, I need to go lay down. So I go and I lay down, and I think by the time my body hit that couch, which was only like maybe a second or two it was probably a full like 10, 15 seconds after I got dosed up. Hey, you don't need that. Okay, now I guess if you want your sister to have it, go ahead. It's probably a 10, 15 seconds before I got dosed up. And by the time I hit that couch, I was on another existence. I remember I was trying to open my eyes, but it was just so intense. Like, the feeling that I had over me was so intense. So I closed my eyes, and I was like, oh, I'm about to have a panic attack. I'm about to have a panic attack. I'm freaking out right now. Like, I am about to lose my mind. This feeling is too much. And I remember in one part of my head, it was like, what if this happened to you? It was like, what if the worst thing that you can imagine to happen to you, what if that happened to you? What would you do? How would you survive that? What would happen if your world just fucking fell apart right now? What if you got out of this trip and your world was gone? No, everything you loved, like, just fell apart and was not a part of your life anymore. And I was like, oh, fuck, dude. I was like, I'm about to lose my mind. And then this other part of my brain was like, well, so what if that happens? You've survived everything, so now you survived being sexually abused, you survive being in the Army, you survive, years of, trauma and abuse, as well as, among other things. Why wouldn't you survive that? And I thought about it, and I was like, you're right. I have survived those things, and, if this thing that I'm so scared of happens, I'll be okay. It'll suck for a long, long time, but I'll survive that, and I'll be okay. And this, like, feeling of calmness and, like, just okayness, I guess. I don't know if that's the word to describe it. Just washed over me, and I was like, it's going to be all right. If something that I don't want to happen happens, it's okay. I'm going to survive it. Because there's no reason. It's that thing of with trauma, it's like, you're so scared of it. You're so scared of, you relive it, this, that, and the other, and you're scared of it. And it's like, why? Because, like, it doesn't make much sense to be scared of something that we already survived. We already did that. We're so scared of it, this thing killing us and breaking us, but it never did. We are still here. We still made it. We are functioning. We have some fucking problems. We're all a little bit fucked up. That's probably why you're here. But we survived, and we're going to be okay. So that feeling, like, washed over me, and I was like, oh my God. I was like, that was it. And I've had that happen to me before when I'm sober. My brain just being like, chill out, bro, chill out. But that side of my brain that's like, fuck no, everything's going to go into self-destruct mode, is very loud during those times. But this time it was immediately just shushed, and it was awesome. So after that feeling departed, I got to put on my sick fingerless gloves, dude. Hold on. So after that feeling departed, then I still couldn't keep my eyes open because the trip was way too intense. Then I lost all sense of time, and that is something that has never happened to me before. And let me tell you, it is one of the most terrifying things ever, because everything in our entire life is dictated by time. Whatever you think, whatever you're like, no, not everything. Everything is dictated by time. Time is literally what rules us besides money. And it's funny because time really doesn't exist. Clocks exist, and time, it really is a construct. But like we said in the podcast, if the Earth had stopped spinning, if the Earth had lost its, tilt and stuff like that, if we had lost the moon millions and millions of years ago, our days would only be 4 hours long. But, whatever. So you can listen to the podcast and fucking listen to that shit on your own time. But yeah, time really dictates everything in our life. We are ruled by time. Time can be a scary feeling or a good feeling. I have a lot of time left. Yay. I don't have much time left. That's scary. But it's just this, and it's something we don't think about. We don't think about how much our life is dictated by time. Until you lose it, like the sense of it. Because once I lost the sense of time, it was like this terrified feeling, but I was also very calm. Like, I was very okay with it. And I was like sitting there with myself, I was like, okay, but I gotta kind of try to figure out how long I've been in here. So I'm thinking about when Dr. Livingston injected me with that needle, with that syringe full of ketamine, and I'm thinking about, I'm like, how long ago was that? How long ago was that? And it felt like years. I really couldn't dictate how long ago it was. It literally felt like it was 2 years ago. And I was like, I know in my head that wasn't that long ago. It was recent, but why does my brain keep telling me that was years ago? It doesn't make any sense. I remember I opened my eyes and I was like looking at my phone, and it was so hard to text, but I was typing out a text to Dr. Livingston that was like, bro, how long have I been in this room? And I never sent it because I closed my eyes again and just fucking went out. But once I closed my eyes for the second time after typing that out, I also typed my mom had texted me something too, and I texted her back, and I was just like, I love you so much. But when I closed my eyes again, I went back to losing that sense of time. I also lost, like, my sense of direction. So, like, I didn't feel like I was floating I didn't feel like I was laying on a couch. I felt like I was floating through space. I didn't know which way was up, down, left, or right. I was just suspended in nothingness. And it felt good. Like, it felt like, again, it's a feeling that I've never felt before. My body's never simulated, so it just felt unreal. I would imagine it's kind of what, like, being in a deprivation chamber feels like. What, baby? But it was an unreal feeling, an absolutely unreal feeling. And I remember I had this vision, and it was me and my doctor. It was me and my doctor, because me and him are really good friends. He's such a great guy. We're really, really good friends. But it was me and him, and we were like running through this. We were running through these like really like tall blades of grass. Like, it was weird. It was really tall grass, and I looked over at him, and he had like Viking stuff on, like furs and armor, and he had a shield in his hand and a sword in the other hand. And I looked down at me while I'm running, and I had the same shit on, and I was like, we had like these long beards, and our hair was like knotted up, like and braided or whatever. And I was like, dude, what the hell? And I remember as we were just running, and running and running and running, and then we came to this like open clearing where the grass was like this golden color, and the people that were with us in the office were there as well, and they were all just standing around, and we like joined them in this weird circle. I don't know, dude, it was weird. We were all in Viking era clothing. It was quite the experience, let me tell you. But after that, I kind of came to, and my dosage started to wear off. And Dr. Livingston, because I had to pee really bad. So I was like, okay, bud, we gotta pee. And I took a picture of myself in the bathroom because I was still pretty zooted. I'll upload it here to show you guys. But I took a picture of myself in the bathroom. I was like, how gone do I look right now? So I can look at it when I'm sober and see what I look like. Because honestly, the trip only lasts an hour. It lasts an hour, and then you have this little goofy feeling about you, and Dr. Livingston makes sure that you're okay. And he has you stay there until you're completely sound and sober, and then you can leave and go do whatever you want. But I was quite goofy. Like, the initial peak had worn off, but I was still pretty much wrapped up in that goofy feeling. And I went to the bathroom. I was like holding onto the walls to go to the bathroom. I got in there, did my business. I looked in the mirror and I was like, bro, you are fucked up. So I took a picture of myself so I could look at it when I was sober. I went back into the room and I was just like sitting there, and I was like, what a fucking intense experience. And I passed Dr. Livingston's office, and he was doing some paperwork, and I was like, what's up? And he was like, oh, I'll be in there in a second. He comes in there and sits down, and we just have this fucking super good conversation about like concrete thinking and a bunch of other things. And I explained my experience to him, and he walked me through what some of those feelings might be and stuff like that. And it was all around 10 out of 10. And I feel so good after that. Like, I feel I don't know, I feel like I'm about to fucking cry talking about this. It's weird. I just feel like this weight, a lot of this weight has been lifted off my shoulders. I don't know. It's still there, and it's still crushing, but the pressure is a lot less, If this is something you deal with, I 10 out of 10, 100% recommend doing these. Because I didn't want to do the medication thing either. It's not how I want to go. And one of my things with medication was also like, if I get on medication and I do whatever, I get on medication and it changes me and stuff like that, and then I can't afford it anymore, and I get off medication, and I don't know how to handle myself being me again. Which is probably a really unnecessary, mundane fear. But, I just didn't want to do that. I didn't want to and I also didn't want to go through different medications to find out which one works for me. I didn't want to deal with those side effects. I didn't want to deal with any of that. And with this is like been an absolute saving grace. So if it's available in your area, I 110% recommend trying it out. I will link Dr. Livingston's stuff in his Facebook page and things of that nature. They go live and they talk a lot about what it does to you and how it affects the brain and stuff like that. I'll link that in the description of this video. Please go check them out. Give them a like, give them a subscribe. Phenomenal people over there, and they really, really do want to help you. But thanks for watching, guys. I appreciate it. If you have any more questions, let me know, and I will write them down and bring them to Dr. Livingston, and we will answer them in a video for you. But thank you so much for stopping by. We have some more content coming to you. We're going to do a mukbang and murder next weekend. I'm going to start doing research on the Gateway experience, stuff like that. Thanks for the support. It means a lot to me. I very much appreciate you. You're making all of my dreams become reality. Check out the podcast Snacks Packs. It's on Spotify or wherever you get podcast from. So that's Spotify, Apple Music, literally wherever you listen to podcasts, it's there. Follow me on Twitch. We stream games with members of the Coven, which is our Discord server. We played Toontown last night. It was ridiculous. We played Among Us last night as well with everybody. So definitely give me a follow there. Most of you are here from TikTok, so I ain't even got to tell you the kind of weirdness that goes on there. But thank you for stopping by. I will see you again soon. Be safe. Please be kind to others. Most of all, be kind to yourself. Wear a mask. If you need help, reach out, please. I love you so much, and I hope you have the best day ever.